Hello all of you, welcome back to my channel which is Study Smart with me, and today we are going to discuss another topic from the endocrinology, that is a metabolic syndrome. And we already discussed a lot of topic in a before video. You can watch those two. Okay, now let's begin with our video. So we are discussing a metabolic syndrome, and in that, what is there? Unfortunately, there are a number of competing definitions of the metabolic syndrome around at the present time. It is thought that the key pathophysiological factor is insulin resistance. So what is the factor for this is insulin resistance. Some recommend using criteria similar to those from the American Heart Association. The similarity of the International Diabetes Federation criteria should be noted. Okay, now for a diagnosis of metabolic syndrome, we required at least three of the following conditions which to be identified. Okay, now that is elevated waist circumference. Men would be greater than 102 centimeter and women greater than 88 centimeter. Now another is elevated triglycerides, and which is that greater than 1.7 millimole per liter. Thus you need to remind this criteria so you can able to diagnose the metabolic syndrome. Now another is what? Another is reduced HDL, which is less than 1.03 millimole per liter in males and less than 1.29 millimole per liter in females. Correct? Now discuss about the raised blood pressure, and that is greater than 130 by 85 mmHg, or active treatment of hypertension. Correct? Raised fasting plasma glucose greater than 5.6 millimole per liter, or previously diagnosed type 2 diabetes. Okay, BP will be greater than 130 by 85 mmHg, and fasting blood glucose would be greater than fasting plasma glucose would be greater than 5.6 millimole per liter. The International Diabetes Federation produced a consensus set of a diagnostic criteria in 2005, which are now widely in use. These require the presence of central obesity, defined as waist circumference would be greater than 94 centimeter for a European man and greater than 80 centimeter for European women, with ethnicity specific values for other groups plus any two of the following four factors could be possible. Raised triglycerides level would be greater than 1.7 millimole per liter, or specific treatment for this lipid abnormality. Now, reduced HDL cholesterol less than 1.03 millimole per liter in males and less than 1.29 millimole per liter in females, or specific treatment for this lipid abnormality. Raised blood pressure would be greater than 130 by 85 mmHg, or active treatment of hypertension. Raised fasting plasma glucose would be greater than 5.6 millimole per liter of previously diagnosed type 2 diabetes. In 1999, the World Health Organization produced diagnostic criteria which required the presence of diabetes mellitus, impaired glucose tolerance, impaired fasting glucose or insulin resistance, and two of the following. There would be this is the criteria given by WHO, and where the presence of diabetes mellitus or impaired glucose tolerance or impaired fasting glucose or insulin resistance would be present, and any two of the following criteria would be there. So BP would be greater than 140 by 90 mmHg, dyslipidemia, triglycerides is greater than 1.695 millimole per liter, or high density lipoprotein, that is HDL, which is a cholesterol is less than 0.9 millimole per liter in male and less than 1.0 millimole in female. Okay, now you're getting me what is that? That is having a HDL criteria, that is a cholesterol criteria, and there will be less than 1.0 millimole per liter, right? Central obesity, waist to hip ratio is greater than 0.90 male, greater than 0.85 female, and our body mass index is greater than 30 kilogram meter square. Microalbuminuria is to urine albumin excretion ratio is greater than 20 mg per minute, or albumin is to creatinine ratio is greater than 30 mg per gram. Other associated features would be raised uric acid levels, non-alcoholic fatty liver disease, polycystic ovarian syndrome. Now we will be going to discuss about the PCOS. PCOS is polycystic ovarian syndrome. Now we'll be discussing everything related to that. What are the features and what are the investigations over that. Sorry for that. Now, guys, what is that? PCOS. PCOS is a complex condition of ovarian dysfunction thought to affect between 5 to 20% of women of reproductive age. Now, whom they will be affecting? They will be affecting a women of reproductive age, and that is the ovarian dysfunction. Correct. Now, the etiology of PCOS is not fully understood. Both hyperinsulinemia and high levels of luteinizing hormone are seen in PCOS, and there appears to be some overlap with the metabolic syndromes. Correct. Now, there will be hyperinsulinemia and high level of LH. Okay. Luteinizing hormone. Fine with you? Okay. Now we'll be discussing about the features. There will be a subfertility and infertility. It would be possible. It will lead to subfertility or infertility. There is a menstrual disturbance. You guys know about PCOS, right? You have studied about it. So menstrual disturbance would be there. There will be oligomenorrhea and there will be a amenorrhea. Hirsutism, acne due to hydrogenism. And you guys know about it. Hirsutism is what? Hairs in growth of hairs, right? Now, obesity, acanthosis nigricans due to insulin resistance. You know about the acanthosis nigricans, right? The dark pigmentations occur. Yes. So, let's discuss about the investigation. How you can investigate this. Pelvic ultrasound, multiple cysts on the ovaries. When you do the pelvic ultrasound, there will be multiple cysts on the ovaries. Okay. FSH, LH, prolactin, TSH, and testosterone are useful investigation. Correct. Raised LH is to FSH ratio is a classical feature but is no longer thought to be useful in diagnosis. Prolactin may be normal or mildly elevated. Testosterone may be normal or mildly elevated. However, if markedly raised, consider other causes. Correct. Check for impaired glucose tolerance. Now, what we are discussing about the management, right? So, what is the management? PCOS is a complex condition which is for the ovarian dysfunction. Revise it with me. And this affects between 5 to 20% of women of reproductive age. Management is complicated and problem based partly because the etiology of PCOS is not fully understood. The thing is, etiology is not yet fully understood for the PCOS. So, there is some complication for the management too. Now, both hyperinsulinemia and high levels of luteinizing hormone are seen in PCOS, so there appears to be some overlap with the metabolic syndrome. Now, general would be weight reduction. It is the most important thing. A person who is diagnosed with a PCOS or they are thinking that they might be developing that PCOS, I'm telling you, all the girls and all the boys who are having the girls in their life and a person who is going to suffer this or who is suffering for that, you need to tell them that weight reduction is really appropriate for that thing. Okay. Because what happened in this, that patient, that girl will be getting a weight increasement. Okay. So there will be a reduction for the weight is required. If a woman requires contraception, then a combined oral contraceptive pill may be help to regulate her cycle and induce a monthly bleed. Okay. So sometimes that person need to take some contraceptive oral contraceptive pills just to regulate her cycles and to get the bleeding monthly, right? Because there will be a problem in menstruation cycle. Correct. Now, hirsutism and acne, I already told you. Growth of hairs on the face, on the for the females, there are some hair growth which is increased. Okay. Now, oral contraceptive pill may be used to manage what hirsutism. Also, possible options include a third generation oral contraceptive pills which has fewer androgenic effects, or co-cyprinodiol which is anti-androgen action. Both of these types of oral contraceptive pills may carry an increased risk of venous thromboembolism. So everything have a adverse effects too, guys, right? So need to discuss with the doctors before taking any of the pills. Anything if you are thinking that you would be facing any condition which is not good for the health, you just go and see the doctor. Okay. If doesn't respond to oral contraceptive pill, then topical eflornithine may be tried. So what we have given for the fewer androgenic effects, third generation contraceptive pill will be given or cosiprinidol. But what happens? Some like these both types of contraceptive pills would be having an effect for the risk of venous thromboembolism. Now, if doesn't respond to oral contraceptive pills, you have to give topical eflornithine, right? Now, spironolactone, flutamide, and finasteride may be used under specialist supervision. Correct? Now, infertility, PCOS will lead to infertility, right? Or loss of fertility. Now, infertility, weight reduction is appropriate. The management of infertility in patients with PCOS should be supervised by the specialist. There is an ongoing debate as to whether metformin, clomiphene, or a combination should be used to stimulate ovulation. Like this, there is a still debate going on that we should give a metformin or clomiphene or the combination of both of these drugs to stimulate the ovulation. A 2007 trial published in the New England Journal of Medicine suggested clomiphene was the most effective treatment. You guys have studied this, right? Okay, so there is a potential risk of multiple pregnancies with anti-estrogen therapies such as clomiphene. But the thing is, I already told you, everything have a adverse effects. If they are good for something, they could be bad for something, right? Now, that clomiphene will be having some potential risk for the multiple pregnancies with anti-estrogen. Now, the RCOG published an opinion paper in 2008 and concluded that on current evidence, metformin is not a first-line treatment of choice in the management of PCOS. Metformin is also used either combined with clomiphene or alone. So, metformin is not a first-line treatment for the management of PCOS. Metformin is also used either it will be combined with the clomiphene or it given alone, particularly in patients who are obese for the weight reduction that could be used, and gonadotropins. Work by occupying hypothalamic estrogen receptors without activating them. This interferes with the binding of estradiol and thus prevents negative feedback, inhibition of FSH secretion. Now, hypothalamic estrogen receptors it work without activating them. Now, this will be interferes the binding of estradiol, and that will be going to prevent the negative feedback for the inhibition of FSH secretion. Now, we'll be studying about the obesity bariatric surgery. The use of bariatric surgery in the management of obesity has developed significantly over the past decade. Okay, it is now recognized that for many obese patients who fail to lose weight with lifestyle and drug intervention, the risk and expense of long-term obesity outweigh those of surgery. Now, the person who can't able to manage their weight, can't able to reduce their weight through lifestyle modification, exercise, and everything, they require this bariatric surgery. Okay. Uh, for these risk factors, they require this. Okay. Now, nice guidelines on bariatric surgery for adults. Consider surgery for people with severe obesity if they have a BMI of greater than 40 kg meter square or more. Between 35 kg or meter square and 40 kg meter square and other significant disease, for example, type 2 diabetes mellitus, there is a hypertension and they are having this. That could be improved if they lost weight, right? All appropriate non-surgical measures have failed to achieve or maintain adequate clinically beneficial weight loss for at least 6 months. If they were trying for the 6 months and they took everything for the care, but still they are not getting any effect, then it could be possible. At least 6 months, they should try for that. Now they are receiving or will receive intensive specialist management. They are generally fit for anesthesia and surgery. They commit to the need for long-term follow-up. Now, consider surgery as a first line option for adults with a BMI of more than. This is the first line option for adults if they will be having a BMI of more than 50 kg per meter square, in whom surgical intervention is considered appropriate. Okay. Consider orlistat before surgery if the waiting time is long. Now, there are types of bariatric surgery, correct, guys? So, there is a primary restrictive where LAGB would be done. Laparoscopic adjustable gastric venting or sleeve gastrectomy is done. Now there is primarily malabsorptive. There will be BPD. Classic biliopancreatic diversion has now largely been replaced by biliopancreatic diversion with duodenal switch. Now BPD is replaced by bipancreatic diversion with duodenal switch, and it's a mix. There will be Rui and Y gastric bypass surgery, right? Rui and Y gastric bypass surgery, which operation LAGB produces what it will be going to run. LAGB produces what? Less weight loss than malabsorptive or mixed procedure. LAGB would be doing a less weight loss than malabsorptive or mixed procedures, but as it has a fewer complication, but it will be having a fewer complication, which is normally the first line intervention in patients with BMI of 30 to 39 kg meter square. If a patient with BMI greater than 40 kg meter square may be considered for a gastric bypass or sleeve gastrectomy. Correct? Now, the latter may be done as a sole procedure or as an initial procedure prior to bypass. There could be an initial procedure or a sole procedure for the bypass. Primarily malabsorptive procedures are usually reserved for very obese people. Okay, patients would be greater than BMI 60 kg per meter square. Okay, now obesity therapeutic options. The management of obesity consists of a stepwise approach. There will be a conservative diet or exercise, medical, surgical, and orlistat is a pancreatic lipase inhibitor that is used in the management of obesity. Correct? Orlistat is used for the management of obesity. Now, adverse effects includes I already told you, everything have adverse effects too. Adverse effects would be include fecal urgency or incontinence and flatulence. Okay, there will be a fecal urgency. They need to pass out the fecus now very urgently, and there will be a flatulence. A lower dose version is now available without prescription. NICE have defined criteria for the use of orlistat. NICE have defined this criteria. It should be prescribed as part of an overall plan for managing obesity in adults who have BMI of greater than 20 kg per meter square or more associated risk factors. There would be any other risk factors also, or BMI of greater than 30 BMI of 30 kg per meter square or more, continued weight loss, example 5% at 3 months, and orlistat is normally used for less than 1 year. Now there is another drug which is sibutramine, and sibutramine withdrawn January 2010. Okay, by the European medicine agencies due to an increased risk of cardiovascular effects. So sibutramine, what is having this? This is having an increased risk of cardiovascular events. Now, centrally acting appetite suppressant inhibits uptake of serotonin and noradrenaline at hypothalamic sites that regular food intake. Now, centrally acting appetite suppressant would be inhibit uptake of serotonin and noradrenaline of hypothalamic sites that regular food intake. Now, there is the adverse effects include hypertension. So you have to monitor blood pressure and pulse during treatment, constipation, headache, dry mouth, insomnia, and anorexia. Okay. Now adverse effects would be there for this. There will be hypertension. You have to monitor pulse pressure and monitor blood pressure during the treatment, constipation, headache, dry mouth, insomnia, and anorexia. Insomnia, people can't able to sleep, right? Contraindicated in psychiatric illness, hypertension, ISD, stroke, arrhythmia. So this drug is properly contraindicated in a people who is facing psychiatric illness, hypertension, ISD, stroke, and arrhythmias. Rimonabant, a specific C1 cannabinoid receptor antagonist, was withdrawn. This is also sibutramine also withdrawn, right? And in October 2008, after the European medicine agencies warned of serious psychiatric problems, so it caused serious psychiatric problems including suicide, right? Now, this all about the diabetes part in a medicine of endocrinology. So we have discussed particularly everything which is really required and in a very basic kind of thing. Now we'll be discussing thyroid in our next video, and I hope you are liking my videos. I hope you are understanding everything whatever I want to tell you. And guys, I really want you to join my Telegram channel also, where I share some content which is related to everyone, related to the Neet PG, NICT, and FMG. So you guys can connect with me, and the name is Study Smart with me. And now related to the videos, I used to post shorts also. You guys can watch that too, where I used to put flashcards, mnemonics, IOCs, and DOC, which is a short note series and kind of a thing for you. So you can watch those too. And I really want you to stay connected with me. Also, I want one favor, that you share it with your friends and your colleagues, so more and more people will be connected with our channel. And I really want to thank you. Thanks for watching my video, and stay connected with me. Stay blessed, stay healthy, and stay happy, and keep studying. Thank you. Bye bye.